Posterior urethral valves. So these valves or folds of tissue are congenital obstructing membranes within the lumen of the urethra. It affects between 1 in 5,000 to 8,000 males and is the commonest cause of congenital bladder outlet obstruction. They obstruct urinary outflow from the bladder but permit easy urethral catheterization. Because the obstruction starts in utero, secondary changes in the bladder and upper urinary tract are advanced at birth. Some patients may be born with severe renal impairment, or this may develop soon after birth if recognition is delayed. And most patients present as neonates or infants, and occasionally presentation is late in childhood. All male newborn babies should be closely watched to ensure good stream of urine. Prenatal diagnosis is possible using ultrasound. The main causes congenital valves or folds within the lumen of the posterior urethra. The symptoms are poor urinary stream, crying while voiding, straining to void with dribbling of urine, intermittent stream, failure to thrive, fever, poor feeding, abdominal distension. The signs that are usually elicited are voiding dysfunction, palpable bladder and kidneys, respiratory distress, signs of sepsis, for example, fever, azotemia or uremia, and poor physical growth or growth retardation. Investigations FBC, blood urea, electrolytes and creatinine, urinalysis, urine culture, abdominal ultrasound, micturating cysto-uterogram. The main treatment objectives are to prevent and treat renal failure, to remove obstructing valves, non-pharmacological treatment, to prompt bladder decompression and continuous drainage to protect the upper tract from back pressure damage. This is preferably done by vesicostomy in most infants. And indwelling catheters should be avoided in most cases due to complications and death from septicemia. Surgical removal or destruction of the valve. Pharmacological treatment. You treat the urinary tract infections appropriately. Referral criteria. So refer immediately after diagnosis for specialist evaluation and treatment.